Adretop uses, contraindications, and dosage. The dosage and administration of Adretop depend on the patient's age, condition, and specific needs. Typically, the dose is 1 mg per administration, up to 2 mg per 24 hours, administered subcutaneously or intravenously. 1 Actions of epinephrine. Cardiovascular: increases heart rate, strengthens heart contractions, leading to increased cardiac output and blood pressure. Respiratory: dilates bronchioles, facilitating airflow. Nervous system: enhances alertness, focus, and reduces fatigue. 1 Actions of epinephrine. Smooth muscle constricts peripheral blood vessels, reducing blood flow to non-essential organs, while also contracting other smooth muscles in the intestines, bladder, and uterus. 1 Actions of epinephrine. Ocular: epinephrine can dilate pupils, increasing pressure in the eye, intraocular pressure. It also reduces tear, saliva, gastric, and intestinal fluid production. 2 Uses of Adretop. Anaphylactic shock: epinephrine is the first T-line treatment for anaphylaxis, helping restore blood pressure and improve respiratory distress. Cardiac arrest: except for ventricular fibrillation, epinephrine stimulates heart activity, increasing the chances of restoring a heartbeat. 2 Uses of Adretop. Asthma: epinephrine dilates bronchioles, although it's less commonly used nowadays, as selective beta-2 receptor agonists are preferred. Topical use for mucous membrane hemostasis, iritis, and rhinitis. Epinephrine's vasoconstrictive effect reduces bleeding and inflammation. 2 Uses of Adretop. Combined with anesthetics to enhance anesthesia, epinephrine constricts blood vessels, prolonging the effect of anesthetics. 3 Contraindications of Adretop. Hypersensitivity to epinephrine, allergic reactions, severe cardiovascular disease, hypertension, pre-existing heart conditions and high blood pressure, atherosclerosis, hardening of the arteries, hyperthyroidism, overactive thyroid gland. 3 Contraindications of Adretop. Cardiac arrest due to ventricular fibrillation. This type of cardiac arrest requires different treatment. Diabetes mellitus: epinephrine can affect blood sugar levels. Glaucoma: increased pressure in the eye. Urinary retention due to obstruction: epinephrine can worsen this condition. 4 Dosage and administration of Adretop. The dosage and administration of Adretop depend on the patient's age, condition, and specific needs. Typically, the dose is 1 mg per administration, up to 2 mg per 24 hours, administered subcutaneously or intravenously. 5 Side effects of Adretop. Cardiovascular: increased heart rate, chest pain, high blood pressure. Respiratory difficulty, breathing, bronchospasm. Nervous system: tremors, anxiety, headache, dizziness. Gastrointestinal: nausea, vomiting, abdominal pain. Skin rash, itching. Important notes: Adretop should only be used under the guidance of a healthcare professional. Do not self-medicate with Adretop. Store the medication in a cool, dry place away from direct sunlight. Report any side effects to your doctor immediately. Additional information: Adretop is not a cure for any disease, it merely alleviates symptoms. Patients should adhere to their doctor's instructions and use the medication appropriately. Adretop should not be used during pregnancy or breastfeeding unless absolutely necessary and with the doctor's approval. Additional information: disclaimer: this information is for general knowledge and should not be considered medical advice. Consult with a healthcare professional before using any medication.